Hello, I'm Tina Jennings. Now today we're going to learn about a condition where a person has the inability to understand or express language. Speech pathologist Kyle Meades from the Therapy Group of Tucson is here to explain what it is and kind of dive a little deeper into it. So Kyle, let's start out with what it's called and then we'll kind of talk about what it is.
Yeah, this disorder is called aphasia, and aphasia is essentially the absence of language. It normally happens after a stroke, where people lose the inability to express themselves or understand what's being said to them.
Interesting. So now you said a stroke is that the only cause, or are there any other causes that can bring this about?
You know, most commonly it's a stroke.
Okay.
I mean, normally you will see aphasia in older persons. For example, someone who has a left-sided stroke, the brain has two halves, yep. The left side of the brain and the right side of the brain. Language is normally located in the left side of the brain, and that's where the stroke occurs. Broca's area, they call it, area 44. And that causes damage to the part of the brain that allows people to say what they want to say. And then a lot of times people who have aphasia, they know what they want to say, but they just can't get the word out. And then they get very, very frustrated.
I can only imagine. Is there maybe different types or maybe different degrees of it?
Yeah, it can be very mild or it can be debilitating, very severe. A lot of people that we see, people come in, the biggest complaint is they think their spouse or loved one has a memory problem because they can't, they think they can't remember what they want to say, but in actuality, after we run some of our assessments, they have word finding abilities. But yeah, it can be very mild, where you have the mild word finding problem, to you can't express yourself, and we have augmentative communication devices. I spoke about that on our last segment. AAC devices, we can use those with adults who can't communicate, so sometimes we can set them up with a computer system to help them talk.
Well, I find that to be interesting that you are kind of giving us a scenario that maybe family members, like you said, maybe think somebody has like a memory loss, or they're just having a hard time remembering things. So this is exactly why we come in, to kind of narrow it down to really what the root of the problem is. So how do you go about diagnosing something like this? And it's not just a memory problem.
Right. The biggest referral we get from physicians in town, it will be, 80-year-old person, status post-stroke. And that person will come into the clinic. We will give them a series of assessments where we have them name pictures, repeat sentences. It's a big test. It takes about an hour to give. And we can tell what type of aphasia they have, either an expressive aphasia or a receptive aphasia, understanding language. And a lot of times people will have not only just aphasia, they might have some swallowing problems. They may have problems making voice. I've spoken about that on other segments here. They may have articulation problems or dysarthria, which is a weakening of the mouth where they can't actually physically say the sound. So there can be other problems associated with the aphasia as well. And that's why it's good to get in with a speech pathologist who knows and understands this disorder. And the Therapy Group of Tucson, we definitely know aphasia.
And just kind of listening to what you're saying, all of these, you come on each time, we kind of focus on, one thing at a time so that we can kind of dive a little bit deeper. But do some of these things kind of like blur together, and they can kind of be multiple things? As you were saying, somebody might have, a hard time swallowing, but they might also have this. Is this another reason why it's so important to come in and kind of attack everything that may be happening?
Yeah, absolutely. Again, it's not normally just one problem.
Yeah.
It's not normally just aphasia or a speech problem or a swallowing difficulty or voice problem. A lot of times, for instance, with adults after a stroke, you're going to see many problems. You're going to see maybe some cognitive language. I was talking about the left side of the brain where language is, but maybe a person has a stroke on the right side of the brain. They're going to have problems with judgment, reasoning, insight, memory. That's the kind of deficit you'll see with a right stroke. But on the left side of the brain, you're going to see more of aphasia. So yes, when you go to a speech pathologist's office, we're going to test all of those things. We're going to do a swallow assessment. We're going to do a fluency assessment. We're going to do a voice assessment. We're going to do a speech assessment. And we're also going to do a language assessment. We're going to look at everything we can to help that and ensure that person gets better.
And maybe someone at home either has somebody that they know that's going through this, or they, like you said, the frustration is in themselves. But maybe what's keeping them from coming in is cost. What about insurance? Does insurance ever step in for something like this?
Absolutely. That's a very good question. Now, with people who have Medicare, Medicare allots about $1,980 for therapy treatment. Now, that therapy is combined, the speech therapy is combined with physical therapy, so you have $1,980 to use on speech and physical therapy. So if that patient has some physical therapy, you kind of want to see where they are money-wise with Medicare. Now, certain types of aphasia, you can get a justification to exceed the $1,980. But definitely, if someone has Medicare or a Medicare supplement like AARP, or just a lot of common carriers like Blue Cross, Blue Shield, TRICARE, those plans definitely do cover the cost of care because it's a medical condition. You can put a lot of times if someone's got a stroke, you can see that on an image.
Yeah.
When the physician writes that order, they'll pay for that.
Well, I love that we're talking about cost, because I know that can sometimes
Absolutely.
worry people, and we're also letting people know that there's a way to get some help.
Absolutely.
And that's why each time you come on and we tackle a different disorder and what we can do about it. So I want to thank you so much again for coming in. Well, we have to get everybody in to talk to you first, like we were saying. So if you need speech or occupational therapy services, call Therapy Group of Tucson at 232-2021, or for more details, visit supportvoice.com.